You want to hit 2014, and then we'll get into some questions?
It's just right at 9:30, so we'll touch on 2014, and then we'll move into an opportunity for Q&A. So we're approaching 2014, and this is another very significant point in healthcare reform, because this is the point where the exchanges come into play, and as Terry mentioned earlier, the player pay rule. So this is where a very defined definition of FTE, full-time equivalent, comes into play, and it's 30 plus hours a week. So if you are an employer that has more than 50 FTE, full-time equivalents, 30 plus hours a week, you will be in the player pay arena. And so that creates an environment that if you discontinue offering employer-sponsored insurance, there are penalties that will come into play, and there's very specific calculations. There's also a penalty that comes into play if you continue to offer employer-sponsored insurance, but it's deemed to be unaffordable to any of your associates, and they go to the exchange and receive a credit or a voucher. You have a penalty that you will have to pay there as well. So it's a pretty significant landscape. There's going to be a lot of activity working up to this point. We'll see if it's 2014 or sooner. Some of the comments coming from some of the regulators have indicated these are our deadlines. There's no reason this can't be done sooner. So a lot of political activity that takes place between now and 2014. So I think there's some internal momentum to maybe move some of these things forward on a quicker timeline. We'll have to wait and see. So the biggest thing in 2014 is the exchanges. We talked about a couple of the other things earlier that come into play in 2014, so I won't repeat those. We're going to end this in terms of the presentation on a high note, because one of the other things that happens in 2014 that is a very good thing that potentially we would have liked to see happen sooner is an increase in the wellness program rewards cap. Currently that's a 20% premium equivalent. In 2014 that increases to 30%. By the way, you have to lose your grandfather status in order to qualify for that extra 10%. And Health and Human Services has said there is an opportunity potentially for the Secretary of Health and Human Services to deem that to be as much as 50% reward incentive. We don't know what that criteria is going to look like yet for that increased amount. So we've navigated up to and slightly through 2014. Hopefully we've ended it on a positive note in terms of wellness programs, and I think it's time for questions.
Absolutely. If you have some questions that you want to write down on those pieces of paper, on those tablets that Kennedy and Coe gave us, go ahead and write those down, hold them up, and somebody from the Business Journal staff will be by to pick those up, and they'll bring them to me and we'll get them asked. Also, we have an option. We have a couple of microphones that folks have from the staff. If you want to stand up and ask your question, you can do that too. We had a couple of questions from some readers as we prepared for this. One of the things dealt with contribution differentials. Will that still be possible?
Potentially, right?
Potentially. And as Karen described earlier, if you're contributing different amounts based on the either salary classification or earning level of your employees, that will be subject to the new non-discrimination testing requirements, and depending on what's being contributed and to who, then you could run afoul of that internal revenue section starting in 2011.